Hallux limitus. Also known as a dorsal bunion. What is hallux limitus? This is seen as a bump on the top of the joint where bunions are commonly found. In this condition the patient is unable to fully dorsiflex, bend upwards, the big toe. Pain is usually, but not always, associated with this deformity. Most authorities states that the big toe requires from 60 to 80 degrees of dorsiflexion in normal gait. Many people can get away with less than that due to compensation mechanisms in their foot function. What causes hallux limitus? Repetitive microtrauma. For most people the cause of hallux limitus is repetitive microtrauma where the big toe is constantly jamming into the first metatarsal bone. Trauma to the joint by dropping something on it or falling down. Gout attacks, repeated gout attacks over time, will cause damage to the joint. Excessively long or short first metatarsal, the length of the metatarsal bone can affect the ability of the big toe to move upwards. Dorsiflexed first metatarsal bone, an elevated first metatarsal does not allow the toe to bend up over it. Pronation. In most cases this is a progressive deformity where the patient will relate that the pain initially started as a dull ache which was transient in nature but has progressed to the point where the joint is now painful on a regular basis both in and out of shoes. Treatment of hallux limitus. Hallux limitus and hallux rigidus can be treated both conservatively and surgically. Conservative options. Anti-inflammatory medication, short doses over a period of a couple of weeks in an effort to quiet down the inflammation. This should be regarded as a temporary measure and not a long-term solution. Cortisone injections may be of use for short and moderate time period relief. Depending on the effectiveness, multiple injections can be performed, but there is a limit as to how much cortisone can be injected in the same area in a 1-year period. Physical therapy may also be helpful in reducing the inflammation occurring in the joint. This can be combined with anti-inflammatory medication or cortisone injections. Orthotic therapy. An orthotic may help stabilize the joint with the addition of a Morton's extension. Other times a cutout underneath the big toe joint might create more motion. Most cases of orthotics for hallux limitus require trial and error. Shoe modification. Many times an extra depth shoe with a stiff sole can be helpful in reducing the discomfort. Modification of activities. In severe cases the avoidance of certain activities may go a long way to reducing the symptoms. Surgical options. When conservative measures have failed and the pain is great enough, then the patient should consider surgical intervention. Like most medical conditions, not all hallux limitus is the same. Things that have to be addressed are underlying causes of the condition, the type of gait the patient exhibits, the amount of bony overgrowth, the amount of joint destruction, the type of activity the patient would like to resume, the limited or lack of joint motion, and of course the amount of pain. Joint remodeling. Many times a patient can get by with just a remodeling of the joint, meaning all the bony overgrowth is removed, which should allow for better motion without pain. This is known as a chelectomy. Osteotomy. Sometimes a wedge of bone will be removed from the top of the first metatarsal in an effort to allow the big toe to bend upwards over the metatarsal. This is known as a reangulation osteotomy, surgical cutting and realigning of bone, which will allow better toe dorsiflexion, toe bending upward. Joint destructive procedure, or implant. If the cartilage is destroyed, many times a joint destructive bunionectomy will be performed or a joint implant will be inserted. First metatarsal phalangeal joint fusion. If the joint is too far gone and cannot be salvaged, the joint may actually have to be surgically fused. Read the complete article at www.foot-pain-explained.com/hallux-limitus.html